Now, the Department of Health in Limpopo is calling for calm after 16 students returned from China. The Capricorn FET College students arrived home on Friday. The department says the students were under a strict lockdown and were tested before their journey home. It says the students are now in self-isolation. That will last for 14 days. For more on the story, the Provincial Health MEC, Phophi Ramathuba, joins us now in studio. Thanks very much, MEC, for coming into studio. I think let's perhaps just start at the beginning. Before this journey back home, all of the necessary steps were being taken in China already so that any sign of the virus would have been detected before their journey home. That's right.
Yeah, good evening, Michelle, and evening to all your viewers. Indeed, the reports that we get is that necessary steps were done in China in terms of the protocols and guidelines before they were released to come to South Africa. And when they arrived at the airport, again, they were screened in terms of checking their fever and any symptoms, flu-like symptoms. None of them has shown to be having that. And those who said when they were, they were able to confess, some of them, to say when we were in China under lockdown, some of us has to go to be checked and all that. It was done. So unfortunately, the panic that is out there, everybody saying we must come and quarantine them, like National Department would be doing with the military for those who will be coming from Hubei province. And unfortunately, we need to understand, and while we do appreciate as government the panic that is out there and everybody's worried about, I agree with the minister fully when he says there's no need for panic. We need to be calm. If you look at coronavirus on its own, common cold is the mild version of caused by a coronavirus. It's just that we're having this new, the novel one, the 2019 one, which is coming in its severe form. But we can still protect and prevent ourselves. So even this morning, I had spoken to the head of public health, Dr. Matabane. All those students, each and every one has got his cell number. He has given them. He said they've given them bags of masks so that they can be able to protect themselves and the family. And indeed, one question which I was asking one journalist is to say, if indeed there were that high risk grouping, would Dr. Matabane address them without even a mask? He himself, as a public health specialist, will our clinicians, our epidemiologists go and meet them? Our public health nurses go and meet them just like that. So there's no need for alarm. Let's be calm. I'm trusting the team and the report that they've given me because we don't just act. We continuously seek guidance from the NICD. We continuously seek guidance from the ministry and from the minister himself.
The one question that I want to ask you is about this 14 days of self-isolation. Do we trust the students? Do we trust people in general to take all of the necessary steps in self-isolation when you don't have perhaps someone hovering over you, making sure that you stick to those rules and guidelines?
It's unfortunate that trusting human beings, if people still have unprotected sex with somebody that they don't know, you can't guarantee a human being that they don't even have an idea what is their status, knowing very well that that person might be positive and you will be infected. So that is a difficult question to ask. But we are saying, if we mean business about dealing with this a condition, when you are at a lower risk, one of the parents was asking that we need to perhaps create a space and admit them in the hospital, and you can see that is a lack of knowledge. If let's say you have the virus and I'm admitting you in the hospital, that's a biggest risk, because I've got cancer patients, some stage 4, their immune system is already compromised. I've got renal patients. So if you are to infect those ones, it will be a serious challenge. That's why even in our isolation rooms that we have identified in Pietersburg and Prepare Hospital, it's far away from the wards. They will be using a different gate because we must protect also our patients. So for me, to answer your question is to say, we want to trust everyone to say, let's protect each other. our health remains our responsibility as an individual. My health as Phophi Ramathuba, it's my responsibility. And I must take that responsibility and say, you can't expect somebody else to protect your health before yourself can do that. So that's the message that we can always emphasize to everyone.
So, MEC, while I appreciate what you're saying about, don't panic, know the necessary steps are being taken by government, by institutions like yourselves, the point is that saying that the coronavirus really is only an issue when it comes to people, for example, with a compromised immune system, that's a large portion of the South African population. A lack of access to proper sanitation, that's another large portion of South African population. So to say, don't panic, sure, that's a good point, but there are very many people who are at risk.
We know that there are people who are at risk, and hence we are saying all of us must work together to make sure that, first and foremost, you protect yourself. And after protecting yourself, you must protect your loved ones. And then you must protect everyone around you. And if we are to stick to all these guidelines that are there, that are being placed, I mean, as a province, we're not working in isolation. Yeah. And we're saying these learners are not these students. They are not at a high risk that will warrant us to go and get military to give us a place where we'll quarantine them. Because that is the demand that is coming across to say, get us a place where you're going to quarantine. And I'm saying they don't really meet that particular criteria.
So as a final question to you, I mean, we now know that being screened at the airport does not mean you will not test positive for COVID-19 just days later. That first case from Italy, that group of 10 from Italy, is proof of that. So given that these students have now gone through all of that testing before leaving China, upon their arrival here back in South Africa, how often now are they still being tested and screened?
What we have said to them during self-isolation, we have got the national monitoring tool that we have given each and every one of them. Remember, you're quite right to say, if I've been to Italy or China yesterday and I get infected, the incubation period remains 2 to 14 days. I might pass the airport without being symptomatic at that time, and they might not pick up. That's why we emphasize the self-isolation of that particular 14 days, so that if in case at that time there was no symptoms or anything, if they do develop, I will be able to pick up. So that tool addresses exactly that. So we have given them that particular tool, and like I'm saying, they've got an even private number for Dr. Matavan, the head of public health in the province, so that if anything, any doubt, whether it's their parent or their relative or themselves, if they've got any doubt, if they feel like they've got sore throat, they must call him directly, and necessary arrangement will be done for them to go and be seen, and we will take swabs and we'll send to NICD, and we'll definitely look at that. So for me, that 14 days of isolation is to try to address what you have just asked now.
All right. Well, thanks very much for coming into studio. Thanks for clarifying all of those issues. Dr. Phophi Ramathuba is MEC for Health in Limpopo. And we continue